Hello, here's my clinical site profile. So my name is Megan Whitsitt. My clinical unit was 2 West Med Surg, and then my CI was Dora Daniel. And then so for the assessment, the client population is 55 plus, around there normally. The unit staffing pattern, there's typically about 20 nurses on my side. Sometimes it's just like not always at the same time, but about 20 total. And then there's 11 care techs. The patient to nurse ratio is about 1 to 5, and then the number of beds is 30 because they have dual rooms, so there's 2 patients in 1 room. And so that's kind of like upped things a little bit and made it a little more difficult for them. And their typical daily census is 30, so they are full like all the time. On my shift, there was like 10 people down in ER like the whole time waiting for a bed. And then the top 5 health problems, medical diagnoses, surgeries commonly encountered. Hip, knee, joint surgeries are a big one that they come across. Typically patients come in because they're confused. Like 55 plus, that's kind of a normal like sign of infection, so that's a big one. And then cardiac, heart attacks, anything like chest pain, that's a big one. And then respiratory, it tis the season. And then number 5, and she said like the biggest one right now is flu. So those are that. The diagnosis section, the most common is respiratory distress related to influenza. That's the biggest one right now. And then respiratory distress related to impaired oxygenation, trouble breathing, chest pain, anything could really go into that one. Implementation, the psychomotor skills frequently performed is IVs. So she was telling me like they fix a lot of IVs that come up from the ER because they're just down there trying to get it in, get you ready to go up and really be taken care of upstairs. They're just trying to like fix the problem the best they can down there. And then IV site inflammation, so they have to change them because sometimes patients just react like that to the IV. Or like the vein will blow and the IV needs changed. We actually had a patient that happened to. We also had one that she got an IV put in at her nursing home, and she had to have that changed while we were there because it was put in the field. And then their electronic pharmacology resources, most common one that they use is clinical pharmacology. She said that's a big one that just gets used everywhere with HCA. Tells you like what meds are compatible. She said that's really helpful. And then electronic health records, we pretty much use them constantly, like during shift change. She's getting patients from a whole bunch of different nurses. So when she was like down between when they were giving a report, she would get on to the patient's electronic medical record and would look and see like what meds they were on so that she could just know before she got her report from the next nurse. And then we would always go back to it and chart and look at like lab reports to just see like what came up and what we could be doing to help this patient. So like it gets used constantly. And then lastly, my 3 to 4 goals for shifts 2 through 4. I really want to completely start a patient's IV meds like by myself, like obviously with my CI there to help guide me, but like go in and make sure I grab the right thing and then go into the patient's room and like get it all hooked up to their IV site from start to finish, like cleaning, priming, hooking up, setting up the drip, all of that. I want to be able to do that by myself. And then I want to help assist in the discharge education for a patient. I kind of got to do that a little bit on shift 1, but I'd really like to be more involved instead of just watching how they do that. And then I want to assist in gathering admission information from a patient and doing the admission assessment when a patient comes up. We didn't have anybody get admitted this last time, but if somebody does within my next couple of shifts, I would really like to do that. And then my 4th goal, which is my biggest goal, is to start an IV on a patient. So that's going to take a lot of work for me because of my own personal thing with IVs. As a kid, I got stuck and I didn't enjoy it, so I really don't want to like have to do that to a person because I know that it like stings a little bit, but I need to get over that so that I can help my patients to get better. And I want to be able to do that within my next couple of shifts, to really just like watch and talk through it and then do it. So yeah, thank you.